I'm very happy to talk with Dr. Michael Epstein, who is the Senior Medical Advisor for IB Guard. Well, it's actually IM Health Science, but we're going to talk about their product, IB Guard. And this is a medical food specially formulated for the dietary management of irritable bowel syndrome. Let's start off with that, Dr. Epstein, and I'm really thankful that you're calling in from Annapolis and that you're taking the time to help our listeners understand that, because I am sure that we have a senior population here. Many of them are suffering from this. Can you tell us a little bit about what this is to begin with, and then we can get into the product?
Yes, certainly, and thank you, Anita. The irritable bowel syndrome is a very common ailment that people suffer from, and they typically have abdominal cramps, bloating, gas, abdominal distension, and oftentimes altered bowel movement, either diarrhea, constipation, or a mix where they suffer from one or the other at different times. And the illness itself, the syndrome, can be really life-altering for many people. And yet, if you look at the gut with a naked eye, it appears normal. However, we now know that there are a variety of things going on in the small intestine and the gut itself, with inflammation and inflammatory changes that you can see if you look at the gut microscopically that may be creating some of the symptoms.
Is this a preventable disease? I mean, how does one get this?
Well, it's very interesting that you ask that. There are many theories. Recently, evidence has emerged that, at least in some cases, if you get a gastrointestinal infection, let's say, for example, salmonella or a bad E. coli infection, which you get from eating contaminated food, you may, after that infection, go on to develop irritable bowel syndrome. In others, there may be a family history. And more recently, there's evidence that the gut contains a large amount of bacteria, and alterations and abnormalities in those bacteria, which we call or use the term dysbiosis, may be contributing to the development of IBS and some of the underlying small bowel inflammation.
I see. So if someone has I guess there's mild to very severe, and it talks about different kinds. It looks like it's irritable bowel syndrome, then you have functional dyspepsia, then you have ulcerative colitis, and then Crohn's disease. Now, I've known people with Crohn's disease, and it's pretty devastating. It keeps them from traveling, from doing a lot of things.
Right. Well, there's a substantial difference between irritable bowel syndrome, where the mucosa is intact, that's the lining of the gut, remains intact, versus the inflammatory bowel diseases like ulcerative colitis or Crohn's disease, where either the mucosa or the deeper tissues become inflamed and indeed ulcerated. But many of the same symptoms that people have with IBD, like ulcerative colitis and Crohn's, people with IBS suffer from, and often they suffer just as severely. Now, for years, people were told it's all in your head or it's a psychological disturbance, things like that. But in fact, more recent studies and the advancing field of neurogastroenterology, where we're studying brain-gut interaction, shows that this is simply not the case, that this is a significant syndrome, and that while we still don't have great markers for the syndrome, we have good ways of making the diagnosis.
And so you are a gastroenterologist, I assume.
Yes, I've been in the private practice of gastroenterology for almost 30 years now, and one of the most common conditions that we treat is irritable bowel syndrome, particularly irritable bowel with diarrhea, and mixed irritable bowel, where patients have either constipation alternating with diarrhea.
As a side note, knowing you've been doing this that long, you have a very young voice. I would not have known that. That's good. I'm glad. Well, I've been doing radio for a long time, and I usually can tell people by their voices, but you've been taking care of yourself, so that I applaud you for that. I wanted to just go into this a minute. So are there operations that people have to repair this, or if they get on, of course, a medical food like we were talking about, and you're going to talk about the power of peppermint oil and what IBGard is, but is it serious enough that they have to have an operation to cure this?
Well, there is no surgery. In fact, there's no cure. There is no medicine that cures this syndrome, but what we do need is tools to better manage the symptoms, because that's really where we are right now in the illness. And until recently, we haven't had very many effective tools. We've tried dietary changes, and there certainly are things that are helpful. There's a variety of medications, many of which are very, very old, and they've been around for almost well before I started practicing, and the data is rather slim on how effective they are. Now, the peppermint oil itself has been used for several decades in well-controlled studies for patients with IBS, but it never really made it to the United States. It was used more in Europe and other countries, primarily because the delivery system to the small intestine really wasn't there. So you would take the medicine, take the medical food, and it would just release in the stomach all at once, and it really wasn't very helpful. So that's why this new medical food has been developed with a lot of science and effort to bring it into this population, something that's very, very effective and yet extremely safe to manage the very distressing symptoms of irritable bowel syndrome.
So this IBGard, how does one take this? And I mean, is it complicated, or is it like you take Tums in the sense? I know you don't take Tums for this, but
fortunately, I don't have to take Tums. But no, it's very easy to take the medication. You take it either, you can take up to 2 capsules before or after meals. Either way, whatever seems to work better for you, and you can take it up to 3 times a day. Although you may or may not need it that often, so it sort of depends on the individual. Every patient is different. But what's unique is that it contains capsules that have this what we call an enteric coating, which releases these microspheres of this ultra purified peppermint oil in the small intestine. And that technology was developed by IM Health Sciences very specifically to get this medical food to the small bowel, where it can release very reliably in the small intestine.
So are there certain foods that people with irritable bowel syndrome have to stay away from? It causes it? Is it caused by stress? What do you recommend to, besides having this? This is kind of like after effect in a sense once you have it. But what would you tell your patients before?
Well, for years people thought stress contributed to the illness, and it may be that if you're under a great deal of stress, anytime the body's under duress, GI symptoms tend to play a predominant role, and they may become more prominent. But the illness itself is there whether you're under stress or not. It may be not as clinical as apparent. And as far as foods are concerned, many people are searching for that miracle diet. When you talk to patients, they're trying gluten-free diets. They swear that they're gluten intolerant or they're this intolerant or that intolerant. But the truth is, it's very hard for them to tell, and double-blind studies have shown they really can't tell what they're taking or not. But recently, we've learned a little bit that not only lactose, of course, which we all know about, lactose intolerance, which is milk sugar, but also fructose. It's in a lot of fruits and certain vegetables. Fructose can be a bigger problem even than lactose. So we do try to look at those dietary elements, but in the end, they're not the cause of the irritable bowel, but they contribute in some way. So as much as we can, we try to make adjustments in the diet within reason.
Well, of course, we all know that diets are important, but I remember that people, just for example, I was just mentioning that one of our staff members this morning went to the hospital emergency because he has this diverticulitis, and even though it's not the same, it sounded like it was quite painful. Is this very painful if they don't take something for it?
frequently, pain is a prominent component, not to mention bloating, abdominal discomfort, cramps, and often urgency to the stool or a feeling of incomplete evacuation. So it really tends to really run people's lives, where they need to know where the bathrooms are, and they may have trouble getting started in the morning. They may not be able to get to work as often as they could. They miss a lot of days of work. And so in terms of illnesses or syndromes, IBS, irritable bowel syndrome, is just as significant as having, for example, heart disease or diabetes. It does impact greatly on the gut.
I see. Yeah. So little is known about this. I've had a lot of gastroenterologists on my show, and we talk about a lot of things, but of course, colonoscopies and what's happening. But it's the first time I've really spoken to someone about the irritable bowel syndrome, and certainly the first time I've even heard about the power of peppermint oil. Now, I have a daughter who is an acupuncture physician in California, and she's into herbs of all kinds, and I can't wait to tell her about this, because she probably says, oh, of course, I knew about peppermint oil.
I'm sure she has, because it's been really around for centuries, and in the purified form that you find in IBGard and the delivery, it really acts to reduce, the distressful symptoms, the abdominal pain, discomfort, bloating, and diarrhea. And in my own practice, and even in some family members, I've had a great deal of opportunity to use the medical food to really help in that dietary management of irritable bowel. And this is the first product we've had which has been very safe, without side effects really significantly, and has really helped these people to a great deal. This has been known for a long time, but now we finally have something we can actually use.
Well, I'm sure you're thrilled about that, because then you can help your patients. But I was reading some of the background on the founder and chairman, Fred Hassan, and that what a great credentials he has, that he was previously CEO and chairman of the board of Schering Plough Corporation and other significant pharmaceutical industry organizations. What made him do this? And the reason I ask it, because it seems like anytime these things happen, someone discovers something or someone works on something, it's been personal.
Well, he had known for a long time about this and actually tried to bring it forward to his own pharmaceutical companies, but it got stalled or never developed. And subsequently, Mr. Hassan and the clinical and scientists that they have spent years really working hard to develop a very specific process, which they call site-specific targeting technology. So they had to build this technology platform in order to get this medical food into the small bowel and release an individually coded enteric microspheres, keeping it in a solid form so it didn't just dissipate, and so that it would be released in the small intestine where it's needed the most. And that took a lot of years of hard work by some very well-known scientists who've developed a lot of the developed a lot of the pharmaceutical products that we use today that are really blockbuster drugs. So it was not an easy road, but now they've got it, and we're able to use it, and patients are able to acquire it under the supervision of a physician, and it's been a great product that's helped a lot of our patients.
I see where you have done a lot of clinical trials. It sounds like, and maybe with other companies too, but it sounds like you had to do that with this particular product.
Yes, there was a major study. I wasn't one of the investigators in that particular trial, but there was a multi-center trial that recently completed, and the early data, of course, looks very, very good, and it's under review, and it will eventually be published. That study just completed, but it showed very good safety and excellent efficacy. Even at 24 hours, when people started taking it, they got early relief, which is something that's important, especially if you're really suffering. You don't want to be suffering for days or weeks, so this was really, really helpful.
And before this came out, what did your patients do? What did they use? And don't tell
Well,
me
it's
Aleve,
been,
because it sounds like
it is,
everything, you just take Aleve
yeah.
and it's going to end all your pain, right?
Well, you don't want to take a lead necessarily, but we've used traditional antispasmodics, which have been around for decades, and they have side effects of drowsiness, dry eye, dry mouth. So they weren't perfect, and they were of limited efficacy. Occasionally, we used the old standby tricyclic antidepressants, which seem to block some of the allergic component in the gut, and other pharmaceuticals. None of them really got to the heart of the matter, really dealt with the things that we needed to do until IBGard came along, which has both, local analgesic and it reduces gas, making it, very well suited for IBS. In addition, the L-menthol component, which is the active part of the peppermint oil, helps to really enhance the nutrient absorption through the intestinal walls. And so it really is able to manage those very distressing symptoms.
This is pretty revolutionary, I would say. And I was thinking back, and I just want everyone to know how you can actually go and purchase this at your local Walgreens, which I think is phenomenal because there's a Walgreens almost on every corner. So if you are interested in this, and it sounds like this is over the counter, you don't need a prescription, correct?
That is correct.
Okay, that's
You do
good.
not need a prescription.
All right, and if you want more information, you can go to their website, which is B as in boy, Guard, IB Guard, and they're capsules, so they should be taken, of course, as directed by a physician. And most people who have this problem are probably under the care of a gastroenterologist or a family physician. So you can tell them that you heard Dr. Michael Epstein on the radio show, and he was talking all about this. And it's made by IM Health Science, and they are actually found living their corporations right here in Boca Raton, Florida, which is very interesting for us. I would like to move along with this, and because it's a little bit important when we start taking over-the-counter medication, drugs. If you are an elder person, let's say, of course, if you're 40 and you have it, or you're 80 and you have it, do they account for that? And I know in the clinical trials, not all of clinical trials do that. So hopefully doctors understand that, and many don't, that what do you do if you're an elder patient?
Well, the good news is with IBGard and with L-menthol peppermint oil, the medical food itself, one of the definitions of a medical food is that it's generally recognized as safe. In other words, the FDA and the manufacturers have certified that the product itself is considered safe in the dosages that are used to treat, this dietary management of irritable bowel syndrome. So we don't really have to worry about adverse events or side effects other than very, very rare minor things. Certainly if you're allergic to peppermint oil or something like that, you wouldn't want to take it. But in general, there really aren't any side effects that we have to worry about, as opposed to traditional pharmaceutical medications, which, as I mentioned, have a lot of what we call the anticholinergic properties, with the dry mouth, dry eyes, drowsiness, things like that. So that can affect an older person who already has trouble seeing, maybe has blurred vision. We don't want them to get drowsy. We really have to be careful with those pharmaceutical products. With this, we don't have to really worry about those particular adverse events.
I see. Well, that's very good news, because I know as a gastroenterologist, you're very familiar with that occurs when people take pharmaceuticals. Sometimes it's really too much for an older adult. So that means that it's quite safe. So the IB Guard, how long has it been around? Is this pretty new?
Yeah, well, this is very new. There were, of course, multiple clinical studies and some very good clinical trials using other forms of peppermint oil in the treatment of IBS that's been done for years. And if you look at the European data, particularly some of their better studies. Some of their very famous scientists have done a lot of work in that area. For example, in England, peppermint oil compounds are listed as one of the top treatments for IBS. So it's been around for a long time, and there is an awful lot of data and what we call peer-reviewed studies where experts have looked at this. And I've personally sat in on sessions where they've discussed this at our meetings, the digestive meetings, and given very good reports of it. Now with this newer formulation, which is really brand new, we have a better opportunity to use this medical food and help our patients with their symptoms.
I'm so happy to hear this. Dr. Epstein, one thing I would request is if you can somehow email me your picture, because I would like to put this very important radio interview on YouTube. I don't know if you're on YouTube yet, but then everyone around the world will be able to hear you and see you. So I request that. And I'm sure
certainly,
if you go ahead and you talk to the people over there at IBGuard, I'm sure they can figure out how to send it to our email, because these are subjects that people may go to medical conferences. As a matter of fact, Palm Beach Medical Society, which I'm involved in, is going to have a wonderful conference. And I'll just, as a side note, it's the first conference that they're going to actually talk about medical marijuana, which I think is interesting to have out of a Palm Beach Medical Society. But, these kinds of talks that we're doing now, we do a lot on our radio show because of being a gerontologist, and I really feel that this is important for people to hear. So we do entertainment, but we do a lot of medical, and you're certainly a star talking about this. You're articulate, you're knowledgeable, and it's not someone doesn't talk about this at the dinner table. They don't say, "Oh, hi, I have irritable bowel syndrome," and so this is kind of in the confines of a medical office, or it's very personal. So we bring it out. That's not personal. People should not be ashamed of it. Just like any other kind of do we call it a disease?
Well, I call it a syndrome.
Syndrome.
And you're absolutely right. This should be brought out in the open. We do need, as many possible treatments for this as we can get. We need to learn more about this. We need to continue the science. This is a good step and something that's very valuable and helpful in treating this condition. This illness has been around for centuries, really, and we certainly need to make people more aware of it.
Do children get this?
Oh, yes, absolutely. Now, typically in children, it often goes by another name, abdominal pain syndrome, where they have pain around the umbilicus, around the belly button, and they don't go to school, they miss days, they're miserable, they come home early, but it really is a form of IBS, and that certainly also deserves more study. I treat children as well, and it can be very frustrating for the parents, for the child themselves, and it's a very poorly understood. You don't really find anything, and everybody's convinced there's an organic illness there, where there'll be something that'll need surgery, and they go from doctor to doctor. It is a very difficult, distressing problem, but in fact, in majority cases, you don't find anything organic in those children.
Oh, that's very interesting. I can hear it now, where a child has this, and they just say, well, they don't want to go to school. Probably a lot of myths surround this problem.
Absolutely.
It's kind of like fibromyalgia. For so long it was, oh yeah, that person's just faking it. We can't tell what that is, and now we know it's really true. So, well, that's interesting. So it's a child's, but it's under a different name. It's abdominal pain syndrome, and the belly, it's right where the belly button is. Well, hopefully people who are listening, if they have this in their family with any of their children or grandchildren, they will be not so casual. Now, would those children be taking the IBGuard?
IBGuard has not been studied yet in a population of children. I don't know what that there would be a plan to do so, but certainly it would be a possibility. But right now, it's indicated for adults.
Well, one thing I was reading in some of the information that I received from your organization is that impacts 15 to 20% of the U.S. population. Irritable bowel syndrome? I mean, that's a large population.
Yes, and many people are underdiagnosed, or they're not diagnosed, or misdiagnosed. So there's a lot of people that have never gotten to the healthcare system with these symptoms, and yet they suffer every single day. So it is important to get the word out that there may be things we can do to help alleviate some of the symptoms. It's certainly true that IBS has a very profound impact on the quality of life. So as we gather more tools to treat it, including IBGuard, and the science moves forward, it's very important that these patients do come forward if they're really suffering.
Well, I have so many questions to ask. We may have to do this in another before we have to end the show. But if someone has functional dyspepsia or ulcerative colitis or Crohn's disease, would this help at all?
We don't know, because that wasn't really the population that was studied in this group. It's often, though, in my own practice, just speaking anecdotally here and not from necessarily the science, but there are many patients with IBD, such as Crohn's or ulcerative colitis, or even functional dyspepsia. It's a whole other topic. But they have symptoms of irritable bowel syndrome superimposed on their Crohn's disease, for example. And if you don't recognize those and treat those, the patient remains miserable. And often the physician feels like he's done a great job treating the Crohn's disease. The patient still has symptoms, not understood why, because IBS often goes hand in hand with IBD, although they're really two different conditions.
Well, you really are a great guest. I mean, I have learned so much from you, and I want to thank you so much again. I look forward to another talk because I have lots of questions now. Thank you again, and just get me that picture, okay?
Certainly will. Thanks again.
All right, thank you, Dr. Epstein. Bye.
Take care now.